I will have to say that this is one of the most common questions I get asked all the time, but it's one of the most difficult. We don't really know exactly why cancer appears, and this is something that applies to almost any kind of cancer. Simply, we know that cells are supposed to reproduce and divide at a certain rate, and there is something that makes that cells start to reproduce uh, in a too fast, uncontrolled, I would say. Uh, Specifically with cervical cancer, there are certain genes that are related, and actually now there are biologists and doctors working, trying to figure out and actually identify which specific genes are related with this cancer and make certain people have more probability of having it, so we can develop an earlier diagnostic test. Who is at risk? Well, of course, being women, the only that have a uterus, well, this is women's cancer. Um, but even though any women can have cervical cancer, obviously there are certain things that make certain women more prone to have cervical cancer. Of course, the first and most important risk factor is the human papilloma virus, or the HPV. I think a lot has been said about the HPV and the relationship with certain types of cancer, but the most important is with cervical cancer. I'm gonna just give you some little explanation about the human papilloma virus. The HPV is a virus that is spread almost everywhere. We can say that 85% of the population are or have been infected by this virus. But there are more than 150 subtypes of this virus, and most of them are related to some other conditions or to no condition whatsoever. They usually cause what we call papillomas, which are like skin, uh, they affect the skin and they cause like some skin lesions. Very, very common within people, not malignant whatsoever. Now, we have identified certain specific subtypes, especially HPV 16 and 18, as responsible for being a risk factor for cervical cancer. Why? Because this virus specifically infects cells from outer layers of the skin or certain mucous membranes. And as I was telling you, this cancer develops in the surface. So if something affects the surface of the skin, it will make it more likely to develop cancer. What are other risk factors? Smoking, it's a very big risk factor, not only for cervical cancer, but to other cancers, but it is very important with this one. Immunosuppression, in many different ways. Immunosuppression is basically when the immune system, the defense mechanism of the body, it's not working properly. So it is easier for certain organisms, either viruses, bacteria, or parasites, to get inside the body and cause certain damage. Obviously, nowadays, with HIV being an epidemic, that is like the biggest risk factor regarding immunosuppression, but can also be caused by use of prolonged use of steroid drugs, certain born conditions like um, immunodeficiencies, and either and also and even certain stress-related immunosuppression. So people who are undergoing lots of stress can be immunosuppressed. Diet, and this is very, very important. And nowadays, reading about cervical cancer and some other types of cancers, we started to discover that the diet is very important in not only developing but also uh, treating cancer. Low diets, I mean, diets that contain low fruits and vegetables are related with the appearance of cervical cancer. Being overweight, it's another risk factor, because being overweight causes in women, I mean, both men and women, but in this specific case, women, to have certain hormonal disbalances, because many of the hormones are uh, fabricated by the taking the cholesterol as the like primer, and everything, the rest of the hormone just builds itself in that core. The core is the cholesterol. So if you have more fat, you have more cholesterol, then you have more hormones, and those hormones can be a risk factor for cervical and breast cancer also, but in this specific case, cervical cancer. And uh, having the first baby before the age of 17 is a risk factor for developing this. And nowadays, it's something that is being seen all around the world now. 16-year-olds and 17-year-olds are getting pregnant. So they are a specific group that has to take care of very specially, and have to go to the doctor to get assessed and screened for cervical cancer.